So here on this X-ray, if we take a few minutes just to have a look and see, do you see anything abnormal on this? You could pause the video. Okay, so let's go through it now. So this X-ray is actually normal. So we have a normal cardiac outline. This shadow here, that's the nipple shadow, and the lungs themselves look clear. So this is normal. The patient was quite short of breath following chemo, so the suspicion was that there was some underlying pathology in the lungs. So a CT scan was done. I'll just show the CT now. So just have a few seconds to look at the CT before I tell you what the findings are. Don't forget to look at the whole of the CT, because you need to put all the bits together. Okay, so I'm going to show the abnormalities now. So if we go through, first of all, you can see there's sclerotic densities in the vertebral bodies. So these are metastatic deposits. Keep going down, you can see that there's also liver deposits. These are large liver lesions. This one there, another one there. So the entire liver is taken up by metastatic deposits. And if we keep going now through the lungs themselves, the lungs are unremarkable, but if we look at the pulmonary artery, which is this is the pulmonary trunk right there. So that's the pulmonary trunk. You can see there's a large filling defect in the pulmonary trunk, and you could see it straddle across over the pulmonary bifurcation. So the diagnosis is that of a filling defect in the pulmonary trunk. So it's pulmonary saddle embolus, and it's called a saddle embolus because it's if you imagine this is the saddle of a horse, it's straddling the horse, so it's lying above this kind of angle there. So this is kind of the saddle that you put on a horse. So that's the pulmonary trunk there. That's the saddle embolus. So we have sclerotic metastasis, a saddle embolus, and we also have liver metastasis and bone metastasis. So this is basically diffuse metastatic disease. Patient is on chemotherapy and has developed pulmonary embolus, probably from a clot in the legs. So that's the diagnosis.